I knew that there were going to be bad things happening all along, because Fauci showed us who he was really early on in the process. And I mean, there are a few things. One is the switch on masks that he pulled, and we're just supposed to pretend like he didn't, and he did, and he lied, and he was a liar, and we all knew it. And he just decided, well, it's the anxiety napkin, right? Like, we need this. I think in the early days, it was mostly that. And then it became more of a political, I'm a good person who takes the virus seriously and all this stuff. I think in the early days, people look, I went out to this grocery store. I'm like ashamed to admit this now. The first couple of weeks, like March of 2020, I was like wearing rubber gloves, because that, I was like, I didn't want to touch anything and get COVID. I didn't know how bad it was going to be. So I wasn't somebody who in the beginning was like, oh, the COVID's not. I was like, no, this is really bad. But he lied about that, and they just let him get away with it, which was completely inexcusable. And then also, that he called Chris Cuomo. There are thousands of seniors dying. I mean, people are drowning in their own lung fluid. Doctors, this isn't talked about very much. A lot of doctors and nurses were also kind of scared to even be really treating COVID patients in the early days in New York. It's one of the reasons. I've talked to doctors about this. They'll admit this. People like to talk about it. They kind of put them on the ventilators really fast, because it was like, put them on the ventilator and see how they do, because they didn't, they wanted to limit interaction, because they were so, look, you could say it's easy in hindsight to say that was overly cautious.
No, I don't blame them.
But that was the attitude. It was like, put them on the ventilator and let's see how they do. Yeah,
if there's some crazy contagious thing that no one knows anything about, and I'm going to play Russian roulette 1,000 times a day, 100 times a day, I'm not going to be doing that even, I mean,
if you go back though to Spanish influenza, which as we know is, very poorly named, but anyway, Spanish influenza actually started, I think, in an American military base, was I think about a 5% fatality rate. They estimate 3 to 5% fatality rate. So, orders of magnitude more than what COVID actually ended up being. If we had a 5% fatality rate disease that was aerosolized and spread with the speed of COVID, you would see the collapse of civilization. And people.
Well, the other thing with the Spanish flu, I read a book about it before COVID hit. So it's kind of
Pale Rider. That's a good one.
The what?
Pale Rider?
No, I forgot what it's called. But it actually killed like males, like 21 to 30 was the main target, which is so counterintuitive that a disease would take out like the symbols of health in any culture.
Yeah, the prime of life, males in particular, and the speed that disease. I mean, there were people would come down with it, and within 12 hours, like their face was blue and they were dead. I mean, it was a totally different level of, So anyway, so we had obviously, thank God, much less of an issue than that would have been. But while there are thousands of seniors dying in nursing homes in New York and other, then soon to be other places, Fauci's calling Chris Cuomo